In science, the most important thing is to never stop questioning, especially in this time of quarantine. Good morning, class! Again, I am your teacher, Krisnel. I hope that you are feeling well today, especially in this time of pandemic. Before we discuss our lesson, let us first recall what we have learned in our last meeting. So last time, we've learned that first, the heart is the muscular organ about the size of a piece. It is located just behind and slightly left of the breastbone. The heart pumps blood through the blood vessel. It has 4 chambers, which are the right and left atrium and right and left ventricle, as well as it has 4 valves, namely tricuspid valve, pulmonary valve, mitral valve, and aortic valve that keep the flow of the blood precise in its direction. Second, blood vessels flow blood throughout the body. Arteries transport blood away from the heart. Veins return blood back to the heart, and capillaries that surround the blood cells and tissue to deliver and absorb oxygen, nutrients, and other substances. Third, blood is body fluid in human and other animals that delivers necessary substances such as nutrients and oxygen to the cell and transport metabolic waste product away from those same cells. We also explore how the blood flows in the body by means of watching a short video clips wherein blood enters the heart through 2 large veins, which are the inferior and the superior vena cava, emptying oxygen-poor blood from the body into the right atrium of the heart. When the ventricle is full, the tricuspid valve shut. This prevents blood from flowing backward into the atria while the ventricle contracts. As the ventricle contracts, blood leaves the heart through the pulmonic valve into the pulmonary artery and to the lungs where it is oxygenated. Note that oxygen-poor blood or the carbon dioxide containing blood goes to the pulmonary artery to the lungs where carbon dioxide is exchanged for oxygen. The pulmonary vein empties oxygen-rich blood from the lungs into the left atrium of the heart. As the atrium contracts, blood flows from your left atrium into your left ventricle through the open mitral valve. As the ventricle contracts, oxygen-rich blood leaves the heart through aortic valve into the aorta and the arteries and eventually into veins to complete the blood circulation in your body. Do you have any questions and clarification about our last meeting's discussion? If none, let us now proceed in our today's topic. So class, our lesson for today is about heart disease that one may get if he or she did not take good care of his or her circulatory system. We will going to explore it by listening and understanding to a story entitled By Heart, prepared by yours truly. Before we start, I will give you a diagnostic evaluation paper. While listening, I want you to act like a doctor that specializes in a circulatory disease. Using this form, write the things that you've observed and learned. This evaluation form will help you in our question and answer part. So now, let's start.
Once upon a time, there was a beautiful island called Heartland. It is named because of the island's unique heart shape. On the said island, there is a boy named Carlo. He lived his life to the fullest. At the young age, he learned to smoke and drink alcohol most of the time. Carlo doesn't eat vegetables, but rather he loves to eat fries, burger, and different fatty foods with his friends. On the other hand, there is a girl named Mina. Mina's mother died when she was only 12 years old. And because she is the eldest among her siblings at the young age, she took a lot of responsibility in their house. Indeed, Carlo and Mina live in a different way. One day, unexpected things happen. As Carlo walks along the street, he experiences shortness of breath, dizziness, and extreme weakness. Eventually, he collapsed on the street. Dr. John saw how Carlo collapsed, and so the doctor rushed him to the hospital. On the said day, Mina is having good times with her best friend Marie. As they having conversation, Mina experiences chest pain, sweating, and extreme weakness. Due to fear that Mina felt, she asked her friend to come along with her to the hospital for a consultation. At the hospital, and with different consultation session, Dr. John diagnosed that both Carlo and Nina are experiencing coronary heart disease through their CT scan result. According to Dr. John, coronary artery disease is the narrowing or blockage of the coronary arteries. This condition is usually caused by atherosclerosis, which is the buildup of cholesterol and fatty deposit inside the arteries, causing minor damage to the blood vessel wall. Other substances that move through the bloodstream, such as inflammatory cellular waste product, protein, and calcium stick to the vessel walls. These things combine with the fat and form plaque. This plaque can clog the arteries or damage the artery, which limits or stop blood flow to the heart muscle. If the heart does not get enough blood, it cannot get the oxygen and nutrients it needs to work properly. This can cause chest pain or worse, heart attack. Some of the symptoms that patient may experience are chest pain, shortness of breath, heart palpitation, sweating, extreme weakness, dizziness, and nausea. In addition to smoking, eating fatty foods, and unhealthy lifestyle that Carlo does are some of the reasons why he got the disease. While in Mina's case, she inherited this condition from her mother who also died because of this disease, as well as the stress that Mina is experiencing from their house, school, and community. With proper medication that Dr. John prescribes, Doc John also advises his both patient to have a regular consultation, proper diet and exercise, as well as to avoid stress, smoking, and unhealthy lifestyle. By this, coronary heart disease may not be triggered. Carlo does not take Dr. John's advice seriously. For him, medicines are enough. He continues smoking and eating fatty foods with his friends. Whereas, Mina wants to live longer. She does not want to die like her mother at her young age. So, she follows the advice of Dr. Yan. With the help and support of her friend Marie, Mina does proper exercise, consuming only healthy foods, as well as reduce her stress while having good times with her friends. After 3 months, Mina became physically fit and healthy. However, with Carlos' negligence, his condition became worse. He suffered a heart attack and soon died. Moral lesson of the story: our body is a gift from God that we should care about all the times. By caring our own health, we can avoid diseases. But as we neglect the more knowledgeable others, like doctors, in terms of maintaining ourselves, we may suffer or worse, die. And at the end, we may regret the chances that we did not take.
Class, I hope that you've learned a lot from the story. So for the question and answer portion, I have here 3 sets of questions. Okay? Are you ready? First question, what was the problem being described in the story? Yes, Claire, you are right. The problem in the story is the disease called coronary heart disease that both Carlo and Mina were experiencing. For the number 2 questions, describe the disease the boy got due to the improper lifestyle. Yes, Anne, you are absolutely right. Coronary artery disease is the narrowing or the blockage of the coronary artery. In connection, if the heart does not get enough blood, it cannot get the oxygen and the nutrient it needs to work properly. This can cause chest pain or worse, heart attack. For the number 3 question, what are the cause, symptoms, and treatment of the disease? Very well said, Mark. Some causes of coronary heart disease are smoking, overweight, fatty food, unhealthy lifestyle, stress, and heredity. Some of the symptoms that patient may experience are chest pain, shortness of breath, heart palpitation, sweating, extreme weakness, dizziness, and nausea. For the treatment, Dr. John prescribed medicine and advised his both patient to have regular consultation, proper diet, and exercise, as well as to avoid stress, smoking, and unhealthy lifestyle, and by this, coronary heart disease may not be triggered. For an additional question, class, do you think what is the most important lesson in the story? Very good, Anne. As human, we should take good care of our own body. So, to elaborate more about our topic for today, let us now discuss Lesson 3 entitled How Do We Take Good Care of Our Circulatory System? So, the objective of this discussion is first to identify the heart-related disease that what we are so-called coronary heart disease. Second is to discuss the cause, signs, symptoms, and treatment of coronary heart disease. Third is to demonstrate some ways to take care of our circulatory system. And last, to create a poster that discusses the proper taking care of our circulatory system. So again, coronary heart disease is a term that describes what happens when your heart's blood supply is blocked or interrupted by a buildup of fatty substances in the coronary arteries. So, coronary artery disease is caused by plaque buildup in the wall of the arteries that supply blood to the heart. So, this plaque is made up of cholesterol deposit, and this plaque buildup cause the inside of arteries to narrow over time. So, for some people, the first sign of this disease is a heart attack. So, these are the common cause of coronary heart disease. So, first is smoking. Smoking is a practice wherein a person ingests smoke that is produced by the cigarette. Second, high blood pressure. The other term for high blood pressure is hypertension. This is the phenomena wherein blood pressure is higher than its normal state. Your blood pressure changes throughout the day based on your activities. Third, high cholesterol. Your body needs cholesterol to build healthy cells, but high level of cholesterol can increase your risk of heart disease. With high cholesterol, you can develop fatty deposit in your blood vessel. Eventually, this deposit grows, making it difficult for enough blood to flow through the arteries. Okay? And then, the fourth one is not being active, or the other term for it is sedentary lifestyle and unhealthy lifestyle, wherein a person practice or eating fatty foods rather than healthy foods. So, lastly is the heredity. Heredity is refers for the genetic heritage passed down by our biological parents. So in this case, not only physical attributes may be inherited to our parents, but also some diseases like the coronary heart disease. So class, like on the story we read a while ago, some of the signs and symptoms of coronary heart disease are cold sweat, angina, dizziness, lightheadedness, nausea or a feeling of indigestion, neck pain, shortness of breath especially in doing activity, sleep disturbance, and lastly, weakness. So again, class, medicines are not enough. For the treatment, making a commitment to the following healthy lifestyle changes can go a long way toward promoting healthier arteries, such as quit smoking, eat healthy food, exercise regularly, lose excess weight, and reduce stress. So again, class, in addition to what we discussed today, there are also some ways in taking good care of our circulatory system. First is eating healthy diet. This means eating a well-balanced diet that consists of a right kind of food in a right amount depending on our age, size, and activity. Second is doing regular exercise and maintaining healthy weight. When we exercise, class, our heart beats faster to allow more blood supply into our muscle. This means additional nourishment and oxygen supply that provide more energy to our body cell. Third is avoiding risk factor. Class, there are controllable risk factors that can be managed and reduced to prevent diseases of the circulatory system. This includes smoking, alcohol consumption, poor nutrition, tension or stress, and physical inactivity as well as unhealthy conditions like hypertension and obesity. And then lastly is getting regular health screening. So regular health screening provide an index for the appropriate action to take in maintaining a healthy circulatory system. Close monitoring of our blood pressure and periodic laboratory tests of our blood cholesterol level and blood sugar, among others, will help us to proper care our own circulatory system. Do you have any questions or clarification? If none, let us proceed in our announcement part. Next week, we will not having a synchronous discussion, but instead, I prepare a set of questions that you will going to answer. This is to evaluate the things that you've learned from the lesson of the circulatory system. So get ready and review for your quiz next week. For your performance task in our asynchronous session, I prepared 2 activities. In Activity 1, you are going to research at least one means or device used to diagnose or detect circulatory system disorder. You will be going to describe how these medical procedures are done to help cure such disease. For Activity 2, you are going to make a poster. Your objective is to present helpful information to the public about effective ways of taking good care of our circulatory system based on the knowledge you've gained in the lesson. Rubrics are attached or posted in our Google Classroom, so kindly check it. The submission of your performance task will be on our next meeting. I hope that you've learned something valuable today. Always remember, in science, the most important thing is to never stop questioning, especially in this time of quarantine. Thank you for your cooperation. See you next meeting. Goodbye and God bless.